Welcome to EduRev. Today, we're going to talk about something that's not just an extra in medical school, it's actually at the very heart of your ability to be a good doctor. I'm talking about your well-being. Because, being a great doctor isn't just about what you know, it's about how you are. And get this, your health has a direct, and I mean direct, impact on your patient's safety. So think of this guide as one of the most important skills you're ever going to develop, how to manage your own health. Ready? Let's get started. So let's dive right into the core question of this whole thing. Why is your health not just your own personal business, but a legit professional requirement? It's a huge mindset shift, really. The foundation of caring for other people is, well, being able to properly care for yourself. Let's break down exactly why. To figure that out, here's our game plan. We'll start by talking about well-being as a professional duty. Then, we'll get into the nitty-gritty of placement pressures. We'll look at coping strategies, the good and the bad, the importance of building a support network, and we'll wrap it all up with a personal action plan just for you. First up, your well-being is your duty. The big idea here is a total shift in how you see this. We've got to stop thinking about our own well-being as some kind of luxury and start seeing it for what it truly is, a professional tool that lets you practice medicine safely and effectively. I mean, this quote on the slide just says it all. Maintaining personal health is a professional requirement. Just let that sink in for a second. This is not a friendly suggestion. It's a core standard of the profession you're stepping into, and it's every bit as important as knowing your anatomy or pharmacology. So here's the bottom line. When you're burnt out, exhausted, or mentally fried, your clinical judgment can get cloudy, and that directly affects the quality of care you give and, most importantly, the safety of your patients. Your health is a patient safety issue. Period. Okay, so how does this idea of well-being as a duty actually work in the real world? Let's talk about navigating clinical placements. This is where all that theory meets reality, which can be, well, pretty chaotic. Knowing how to stay safe is absolutely critical. And placements can feel like you're walking into a storm of challenges. You've got high stress, a heavy emotional load from patient care. It's all real. But here's the thing, you should expect this. Placements are designed to be demanding. So the first step isn't to try and avoid the stress, but to just acknowledge that, yeah, it's coming. So this right here is your non-negotiable safety protocol. Number 1, infection control. It's basic, but it is essential. Follow every single procedure every time. 2, speak up. Trust your gut. If a situation feels unsafe, you have a professional duty to say something. And 3, in any volatile situation, your personal safety comes first, always. You can't help a patient if you end up becoming one yourself. Okay, so you know these pressures are coming. The next logical question is, how are you gonna cope? And that brings us to our third section. See, your coping strategies aren't just little habits. They are major professional choices that will either support or seriously undermine your entire career. You're basically looking at 2 different paths you can take. On one side, you've got the path of growth, healthy, constructive stuff like managing your time, actually getting some sleep, and connecting with people. These things build you up. On the other side, well, that's the destructive path. It's where substance use, isolating yourself, and avoiding help create this really dangerous downward spiral. And I need to be really, really clear on this point. Misusing drugs or alcohol isn't just a bad habit. It is a direct threat to patient safety. It puts your entire fitness to practice medicine into question, and it can have career-ending consequences. So never, ever show up to a placement intoxicated. If you're struggling, the answer is to get help, not to self-medicate. And that leads us perfectly into our next section, building your support network. Let's just get one thing straight right now. In medicine, strength is not about handling everything all by yourself. True strength is having this self-awareness to know when you need to ask for help. In fact, asking for help isn't just a good idea, it is literally written into the definition of professional competence. It's right there. Being competent means recognizing your own limits. It means knowing when you've hit the edge of your knowledge or your emotional battery and having the courage to call for backup. This is a skill, and just like any clinical skill, you've got to practice it. So who's in your corner? Well, it starts with your supervisors and senior doctors. They're your go-to for clinical questions. Then you've got mentors for career and personal advice. Your university has dedicated well-being services. They are there for you, so use them. And finally, Never, ever underestimate the power of your classmates. You're all in this together, and they are a massive part of your network.
All right, let's pull all of this together into our final section, your well-being action plan. Think of this as your professional toolkit that you can carry with you through placements and really for the rest of your career.
So here it is, your final checklist. Let's run through it. 1. Treat your health like it's your professional duty, because it is. 2. Follow every single safety protocol every time. 3. Be intentional. Choose healthy ways to cope. 4. If you see something, say something. Report concerns about yourself or a peer. 5. Get help early. Don't wait for things to boil over. And finally, number 6, always act within your competence. The smartest doctors are the ones who know what they don't know. Remember, taking care of yourself isn't something you just learn once and you're done. It's a skill you're going to practice and get better at for your entire career. It starts right now, and it is the foundation for everything else you're going to build. If you want more resources to help you on this journey from the UCAT all the way through your placements, then you should definitely download the EduRev app for more essential guides just like this one. It's available on both the Play Store and the iOS App Store. Thanks for tuning in, take care of yourselves, and just as importantly, take care of each other.